My name is Lowell Evans. I'm from Virginia Beach, Virginia. And I want to share with you a story because I'm a person who has epilepsy. It was back in 1998, I believe it was. I was driving down the road and I've been seizure free for, I say about 4 or 5 years. I had a feeling come across me where I felt that I lost like a little second or two of my brainwave. And with that being said, I said I better pull off because I want to make sure I have my medication with me. And the next thing I know, when I came to, I was in the back of a police car. And I was riding down the road and I said to the policeman officer, I said, "Sir, what's wrong? What's the problem?" And he just continued to whistle and he wouldn't respond to me. I told the officer, I said, "Sir, I felt kind of funny. That's why you saw me in my car, sitting there, stopped, because I felt a seizure coming on. With that, I stopped just for my own protection and the protection of others." But he still wouldn't listen to me. So when he took me out the car and we entered the building, he gave his answers about me to his commanding officer. The chief looked over the papers, and I guess he ran my license or whatever, and he said to me, "Mr. Evans, I don't see any marks or any driving issues with your license." I said, "Sir, I have no problem with my license." I said, "I don't drink and drive or anything like that. I think I might have had a seizure, and that's why I pulled off the side of the road." And he says, "Well, sir, we need to check on this." And he talked to the officer. Officer said, "Well, I got him out the car, and he wouldn't respond to me." And I told him, I said, "Sir, I couldn't respond to you. I was having a seizure." And the officer said, "Well, he wasn't falling on the ground. He wasn't having convulsions or things like that." I said, "Sir, I have different types of seizures. What I was probably having was called a partial complex seizure, where I don't lose my consciousness and fall out." And his commanding officer said, "Well, didn't you give him the sobriety test, or didn't you give him a breathalyzer test?" And the officer again said, "Well, he would not talk. He would not do the things I asked him to do. I had to kind of guide him to do the things, even to get in the car." Well, I said, "Sir, again, with that, there's no strength for me to respond. There's so many types of different seizures that this officer knew nothing about. So he thought I had been drinking and was intoxicated. I can't drink. I'm on medication." So he said, "Sir, do you think that we can talk this out, maybe learn a little bit from each other about this?" I said, "I think it's great." I said, like I said, I'm still learning more about epilepsy, and I think the officer can learn some more himself. So that we all, kind of shook our head and had a little smile on our face at the end.
Good afternoon. I'm Dr. Linda Bright. I'm honored to be able to talk to you a little bit about crisis intervention, a little bit about my history, and what I do and what I've done. With crisis intervention, we reach out and we will find individuals and find companies that go into their homes and give them support that they need. Some of the things that I do working in mental health or mental illness, we have what they call mental health skill workers, skill building, and these are workers that are credentialed, and they go into their homes. We do virtual calls like Zooming with the children, but we do actual person-to-person calls, and we go into their homes and make sure that they have medication that they're supposed to have, take them to their doctor's appointments, and if they are having a difficult time, we make sure we get them to the emergency room so that they can receive the services. Oftentimes they may be admitted week to 14 days, and if they really are in a severe crisis, we will get them to a place where they might stay 3 months. During this pandemic, since things are shut down, a lot of homeless people are out there. They have no place to sleep at night, no place to go. I have a very close relationship with the police department in the city of Norfolk and in the city of Virginia Beach. The police, most of the time, they'll have my cell phone number. And they'll call and say, Doc, I know we're looking at the corner and there's a lady over here. I think she need a little help. And so I said, what location? And I'll get in my car or send the staff over to see who that is. And so we'll do an assessment on the spot, right then and there with their consent and their permission. And we do what we got to do to get individuals off of the street, to get them into a safe place. Make sure we can communicate with the community services boards and get them a doctor's appointment. We'll do what we have to do. We communicate with family members. We try to reach out and get the client's consent to talk to the family members so we can get a history, so we can understand better what it is. If they're in a seizure situation, you know that if you don't take your medication, the seizures are going to increase. So we try to keep a list of who is providing what, where, and we try to get contact. It has been awesome. You can get a lot done when you are communicating and collaborating with other people who understand what the needs are of individuals.
Hello everyone in the Epilepsy Foundation. This is Dr. Beitinjaneh. I'm a neurologist and epileptologist with a neurology consultant of Tidewater. I'm here based in Norfolk, Virginia, and I operate also the Epilepsy Center of Tidewater here. And my pleasure today to be participating with this program. There is, as you all know, there is a seizure policy with the DMV, and which, you know, if you have a seizure, you can drive for 6 months. So it's pretty straightforward. However, DMV had added some accommodations for patients who, let's, for example, say he had a breakthrough seizure after missing medication, so require a shorter duration of restrictions, which is 3 months. Every month we review cases that, drivers disputed the DMV decision. So we all meet together and review those cases. The interesting task that it's always difficult is with syncope, blackout. So I mean, if it's a seizure, it's straightforward. When there's a lot of cases that are just blacking out events, and per the general DMV policy, it's 6 months for blackout. So we usually review those disputed cases, and there are different reasons for patients and all that. So we give our recommendations about that event, whether we think this is a high risk for recurrence, or this looked like a single event that was provoked, and it should not have a risk for patients. But it is important for the patient to complete with their physicians the seizure action plan. Those are actually forms available at the Epilepsy Foundation website, and we'll have the patient name, their medications, and then what to do in case of a seizure. So there is a first aid steps, and then even you can put more informations there that if you have a rescue medication and all that. So that's action plan, the seizure action plan. It is very helpful if the patient give it to his supervisor at work, so they will know about it. I know there's a stigma about epilepsy, with others, but this is your safety. So if you have that seizure action plan with your supervisor, and then it happened that you had a seizure at work, they know what to do. You can add who to contact. And also there's more details there when they can call 911, seizures lasting 5 minutes. So if your supervisor already have that seizure action plan, that will be very helpful as a rescue tool for you. If you miss your medication, there's a high risk to have recurrent seizure. So this has always been a discussion that we go through with patients is, You have to reward yourself. If you're seizure free, you can live a normal life. You can drive, you can go to work, you can be safe with your family. Yes, so when we treat epilepsy, there is 2/3 of patients that we will control their seizures with 1 or 2 drugs. However, we're left with 1/3 that they have what we call drug-resistant epilepsy or intractable epilepsy. Those are patients, unfortunately, we tried several drugs and they're still having seizures. So we always discuss with them other non-drug options. So, for example, we have diets that proven to help epilepsy patients. In children, ketogenic diets; in adult, modified Atkins diets, they've been helping. And there's also devices that over the years they were available to patients. I mean, the older one that we use for years and we're still using is the vagal nerve stimulator. Over the last couple of years, they came out with deep brain stimulation and also a neural response device. And then the most important one is also epilepsy surgery. So it is very important for patient who gets into that category of drug-resistant epilepsy to be assessed by level 4 epilepsy center, who is equipped for epilepsy evaluation, and if patients are a candidate to have epilepsy surgery, which can be sometimes a cure for epilepsy, especially if you have a lesional epilepsy like temporal lobe epilepsy. So when you trigger a seizure in epileptic patients, even if they are taking their medication, there is no triggers. The famous one are sleep deprivation, excessive alcohol use, especially with the patient with primary generalized epilepsy. Other common cause is missing your medication. I mean, this is a big trigger. So that's something that needs to be cautioned about. Excessive heat, exhaustion, stress, stress, and that can, input triggers also can be avoided as much as you can.